Hello, my name is Tiffany Fuentes, and I'm going to present my case evaluation paper. I actually did my presentation on Forrest Gump. So Forrest Gump is actually a very endearing character who understands he may be slower when compared to others, but stays true to his mother's belief that he must do his best with what God has given him. The beginning of the movie not only introduces Forrest, but it also introduces his mother's attempt to normalize his life, although he has an IQ of 75, which nearly prevents him from being accepted into public school. Forrest also needs to wear leg braces in order to walk because of his diagnosis of scoliosis, or as they put it in the film, having a crooked back. But the doctor does mention that he has very strong legs. This made his youth and adolescence very viable to bullying and being teased for being stupid, and it really did signify how Forrest is extremely resilient and optimistic, because although he was being taunted by the community, he always kept his head up. Again, this may be because of his innocence and naiveness, because of his developmental delay, or it could be the resilience that his mother bestowed upon him. Furthermore, Forrest doesn't let the community's taunts or being called a town idiot get in his way of showing devotion to his loved ones and duties, from being Jenny's best friend and being an admirable PFC in the Army. These character traits bring him into many life-changing situations, and he does his best to care for others as well as make the most of every event that came his way. Forrest Gump exhibits symptoms of an intellectual developmental disability throughout the 1994 film. Intellectual and developmental disabilities, are also known as IDDs, are a group of conditions due to an impairment in physical, learning, language, or behavior areas. These conditions begin during the developmental period, and they may impact day-to-day functioning and usually last throughout a person's lifetime. Most developmental disabilities are thought to be caused by genetics, parental behavior such as smoking or abusing alcohol during pregnancy, infections passed from mother to child, complications during birth, and finally, environmental toxins that the mother and child could have been exposed to. A developmental disability is more than an academic concept. It actually affects the lives of real individuals with a wide array of characteristics. As stated before, there are many different IDDs, with each one having a similar and different components which affect the ability to have complete function in diverse areas. This statement demonstrates that although each individual may have certain limitations, they may also possess their own unique abilities. For instance, Forrest may have a speech impediment, and it may be harder for him to understand the gravity of situations. However, he is fiercely loyal and saves Jenny multiple times from abusive men, and risks his life to save Bubba and his fellow platoon in the deep and dangerous trenches of Vietnam. According to the American Psychiatric Association, Asperger's disorder is a pervasive developmental disability that may have similar features to autism, except in autism there is often a delay in language development, which was exhibited by Forrest because he seemed to not speak much when he was younger, and then slowly developed speech labored in his youth and continued into his middle adulthood. However, due to difficulty with distinguishing socially appropriate cues, the individual struggles with interaction and communication with others, which potentially affects their ability to form relationships. This type of behavior was exhibited by Forrest throughout the film because his only friends were his mother, Jenny, Bubba, and Lieutenant Dan. He rarely made connections with others and instead focused on the tasks at hand and often thought of his loved ones. However, even when Lieutenant Dan would be sarcastic or angry or bitter with him, Forrest did always have an expression of concern or confusion, and we don't really think that he understood the concept of bitterness or jealousy or frustration. So this kind of inability to understand others' emotions or feelings could have also been a marker for his diagnosis. Usually, individuals with Asperger's disorder have an intense interest in a particular topic or activity and may devote a great deal of their time to the newfound hobby, much like Forrest's devotion to ping pong. Ping pong not only becomes a pastime for Forrest, but he even mentions sleeping with his ball and paddle. He is enmeshed in the activity and is then sent from an army base to cheer up his fellow veterans by playing ping pong and even ends up representing the United States in the national ping pong tournament against China. What started as a simple pastime manifested into a talent for ping pong, ultimately earning Forrest a visit with the President of the United States and a check for $25,000 that he later invested into Bubba Gump's shrimping ship and corporation. Many types of medications are actually used to address different behavioral issues and comorbid disorders associated with pervasive developmental disorder, PDD or ASD. For example, the U.S. Food and Drug Administration, FDA, has approved risperidone for use in children to treat irritability associated with autistic disorder and similar developmental delays. Risperidone is an antipsychotic medication that has been used to treat symptoms and side effects of schizophrenia, bipolar disorder, as well as autistic children and adolescents who are experiencing developmental delays. It is critical for clinicians to warn clients of potential side effects, such as impaired thinking of reactions, and one must immediately stop using this medication if the client develops stiff muscles, fevers, overheating, and sweating, fast or uneven heartbeats, restless muscle movements, and tremors. While taking risperidone, the client must also try to avoid driving as well as various hazardous activities because the medication could impair one's equilibrium and has been known to cause dizziness or drowsiness. Finally, a last precaution that must also be mentioned in regards to this medication is one's increased sensitivity to temperature extremes such as very hot or cold conditions. Therefore, drinking plenty of fluids is usually recommended for someone who is taking risperidone. The usual pediatric dose for children and adolescents aged 15 to 17 years old can begin with an initial dose of 0.25 milligrams to be taken orally once a day, and once sufficient clinical response has been achieved and maintained, healthcare providers should consider gradually reducing the dose to achieve the optimal balance of safety and efficacy. Dose adjustments may be necessary if side effects appear, and clients should be monitored closely. Adjustments such as increasing dose, decreasing the dosage, or discontinuing the medication altogether could ensure the client does not experience side effects such as sleepiness, weight gain, nausea and vomiting, dizziness, dry mouth, tremor, confusion, visual changes, and severe restlessness. Furthermore, dangerous side effects such as developing severe blood pressure, neuroleptic malignant syndrome, tardive dyskinesia, diabetes, seizures, stroke, severe allergic drug reactions, or suicidal thoughts may lead to severe low white blood cell count. Under these circumstances, medications should be abruptly stopped, and the individual should also be taken into hospital care to ensure that the side effects or symptoms do not affect the patient. If the medication is working accordingly, some effects may be noticed within a few days, but it may take up to 3 to 4 weeks for the full effects of risperidone to be seen. Risperidone is metabolized to an active metabolite and can be taken orally by disintegrating tablets or a risperidone oral solution. It will probably take several weeks to see big enough changes to decide if the medication is the right medication, as it will take about 3 weeks before risperidone is fully absorbed at an adequate level to begin treating the symptoms. After starting risperidone for the first time or restarting it after a time of no medication, it is important to continue taking risperidone tablets for at least 3 weeks, as well as for the clinician to be consistently monitoring the impact of the medication on the patient. From start to finish, ongoing collaboration and communication between psychotherapist and physician is important. Even at times when no problems exist, a counselor should want to update the physician on the patient's progress. Collaborative counseling is vital, especially for clients who are prescribed new and/or continuing medication. This type of counseling approach validates not only that the client's family is in the medicating and therapeutic process, but also builds a positive rapport with the client in having a say in their treatment. Furthermore, collaborating with the client's physician is also critical in determining if the client is receiving the correct dosage and medication, and ensuring routine check-ins are being completed to see if any side effects or maladaptive behaviors appear. Forrest is a caring, optimistic, and loyal character who stars as the protagonist of the 1994 film Forrest Gump. Although Forrest may express symptoms of developmental delays, he does his best with what God has given him, or that is what his mother tells him to do, and has even been called to be inspirational by many. Despite the fact that many individuals in the film call him stupid, Forrest doesn't let his disability slow him down as he fulfills life goals such as attending college, joining the Army, building a Bubba Gump shrimp boat and the corporation, and even receives a Medal of Honor during his time in the Army. Forrest is still an influential character in cinematic history because of his good nature and his enchanting loyalty to his loved ones. He's an inspiration to us all, and I really enjoyed this project because it not only gave me an opportunity to see Forrest Gump from a different lens, but it also gave me an opportunity to kind of delve deep into myself and really motivate me to try my hardest and do best with what God has given me. So thank you so much, and I hope you have a great rest of your evening.